Hi all, hope you're all doing fine. So today's topic is heparin. Okay, so heparin is actually a very important drug. You could call it a drug, which is very important because it doesn't limit itself to a system. Okay, it's not like we use heparin for only one system. It is a cardiac drug. It is a CNS drug. It is a renal drug. It is a pulmonological drug. It works on the lungs. It works on so many places. So it's a drug that every doctor should know very clearly about. Okay, and to understand the mechanism by which heparin acts, there should be a clear understanding of the coagulation cascade. Okay, so coagulation cascade is nothing but which starts when the blood vessel gets injured. So when the blood vessel gets injured, there should be a clot, right? So it starts from that point and until the it starts from vasoconstriction until the clot is formed. That is the coagulation cascade. You need to have a detailed understanding of the coagulation cascade for you to understand this clearly, and that's why hematology has always been this very tough subject for me in school, college, medical school, college, as well as during my postgraduate days. So I'm still trying to understand and trying to help you understand is the ultimate goal. And this is hopefully the first class in the series of my classes on hematology. I just started with heparin because I felt it was very easy. So to understand heparin, you have to understand a lot about the coagulation cascade, which I have covered in another video. You could watch that and come to this. That will actually provide you with a better understanding. All right. So to start with, heparin is an anticoagulant. Okay. So there might be some first year or second years who don't know what an anticoagulant is. So an anticoagulant is a substance that actually prevents coagulation. All right. So the body needs both anticoagulants and procoagulants. For example, if the blood is flowing well in a blood vessel, the blood vessel is perfectly fine, then we need an anticoagulant. All right. But if a blood vessel is not functioning properly and the blood vessel is actually ruptured, then we need a procoagulant. So in the body there occurs this complex vicious cycle where the blood is in a procoagulant state and the blood is in an anticoagulant state. There occurs a cycle, okay? And blood is actually maintained in a normal blood vessel. Blood is maintained in an anticoagulant phase by three important substances, okay? So the three important substances there are antithrombin 3, protein C, protein S, and prostacyclin. Okay, I will cover more in detail about this in the coagulation class, but right now we have to know that these three are responsible for the blood to be in an anticoagulant state in a normal blood vessel, right? So this is the first point you need to know. Okay, now we'll come to heparin. This heparin is actually a polysaccharide. Okay, it's nothing but a carbohydrate moiety, a chain of carbohydrates that is actually high molecular weight. It is 5,000 to 30,000 daltons and kilodaltons in its molecular weight. All right, so it's a heavy molecule. So first thing you know, it's like a heavy molecule. So I imagine heparin as actually a chain. Okay, you just imagine heparin as the steel chain. All right, so this is the steel chain which is made up of carbohydrates. All right, so this steel chain, it enters the body, it enters the blood vessel, and it goes and binds to this one important substance. Okay, so this one important substance is antithrombin 3. All right, so this antithrombin 3 is like the centerpiece of the mechanism of action of heparin. Okay, so you just imagine this as a chain, and this is the antithrombin 3. Okay, this chain, it binds around this antithrombin 3. All right, this like binds around it and it keeps it in position. Okay, so what does it do when this chain binds around this antithrombin 3 molecule? It follows two processes. Okay, so one is it binds with factor 10A. Okay, so this antithrombin 3 is activated and it binds with factor 10A and inhibits it. So you all know what factor 10A is. Factor 10A is an important part of the coagulation cascade. It's a coagulation factor. It binds to it and it deactivates it. Alright? Okay, this is one. Second, what it does, it binds to another molecule. This is the thrombin. Okay, so again, what is thrombin? Thrombin is a procoagulant molecule. It's a coagulation factor and it inactivates thrombin. Okay, to do this, it has an active part. So it's a huge chain. Okay, but whenever you have a huge chain, the most important part of the chain is where you can actually lock the chain, right? Okay, that is the most important part of this chain. Like this, the heparin, the most important part of this chain is like this part where 1, 2, 3, 4, there is one more here. Okay, I will use a different color. There's one more here. This is a pentasaccharide, okay, 5 saccharides. There is a pentasaccharide here. Which is actually an active part of the heparin chain, okay. So this pentasaccharide helps binding to 83 and helps activating this antithrombin 3, thereby inhibiting factor 10A and thrombin. So this is one point, okay. So there is another difference where this chain is actually long. This is more than 5000 kilodaltons, okay. So only when the chain is long, it is able to bind antithrombin 3 with thrombin. I'll just make it like a bit easy to understand, okay. Let's just imagine that this is antithrombin 3, alright. This is thrombin, okay. So you need to tie them up with a chain, okay. Let's just imagine, like, I just got some rubber here. I just use this as a chain. So I'm just tying this up with a chain, okay. Only if this chain is long, this will be able to tie this up very firmly, okay. But when the chain is short, it will not be able to tie it up very shortly. However, you see factor 10A is a small substance, okay. So let's just imagine this marker as factor 10A, okay. This will be able to bind this easily, okay. Even a shorter chain will be able to bind factor 10A more effectively, okay. But it needs a longer chain to bind factor thrombin and antithrombin, okay. So for thrombin to antithrombin to bind, we need a long chain of heparin, alright. So you understand that. But for factor 10A to act, it needs a shorter chain. A shorter chain is just enough, alright. So this is the first basic point you need to understand about heparin, alright. So why do you have to know that, okay? So in heparin, we all know there is two variants of heparin, okay. One is low molecular weight heparin and another one is Fondaporinix and low molecular weight heparin. So what are these two? Okay, what are these exactly? So what low molecular weight heparin does is it essentially ditches few chains of heparin. Okay, so some chains of heparin are moved. Okay, so the average molecular weight, low molecular weight is only 5000. Okay, in Fondaporinix, what they do is, I talked about this pentasaccharide segment, right? Only that is present in Fondaporinix. 1, 2, 3, 4, 5. Only that is present in Fondaporinix. Okay. So low molecular weight heparin, they just remove few chains. Okay. This has become light. It has become low molecular weight. And Fondaporinix, they only produce that pentasaccharide molecule. Okay. So what is the problem with low molecular weight and Fondaporinix heparin? Okay. So the problem with this is, both of this will cause this factor 10A mediated action. Alright. This will be present with both of this. Okay. But the problem is, both of this do not produce this thrombin antithrombin mediated action. Alright. So this 80 and 82 is exclusively to UFH. UFH is unfractionated heparin. Okay. But this factor 10A happens with both low molecular weight heparin and Fondaporinix. Alright. So which is more advantageous? I just told that UFH has two actions. Okay. However, low molecular weight heparin and fondaparinix, they only have one action, alright. So UFH should be more advantageous than LMWH and fondaparinix, right? Right? No, that's not the case, okay. So the fact is, low molecular weight heparin and fondaparinix are actually more preferred than heparin. Not in all cases, but most cases we feel safer to give low molecular weight heparin and fondaparinix because it negates one of the most important side effects of heparin. So what is the most important? The side effect of heparin is bleeding, okay. So whenever you give heparin, it's an anticoagulant, so obviously there is bleeding, okay. That is reduced with low molecular weight heparin and fondaparinix, okay. That is why they looked for better heparin, okay. So they reduced molecular weight and they made better heparin, that is low molecular weight heparin and fondaparinix, alright, okay. So with this, the mechanism of action is like almost over. There's just a few extra points that I would like to say. Before that, we'll go to the modes of administration. Okay, how is heparin administrated? There's only two routes by which it's administrated. One is subcutaneous, another one is IV. So the EC and IV. So first thing you have to know about heparin is, so the pharmacokinetics of heparin, it is actually a poorly bioavailable drug. So why is it actually poorly bioavailable is that, you just imagine that this is the endothelium. So this is the vascular endothelium. This heparin goes and binds with endothelium. So there is clearance from the endothelium one. Then what this heparin does is it goes and binds with macrophages. Okay. So this macrophages, they consume heparin and they degrade heparin. So heparin has very poor bioavailability because one, it binds to the endothelium. Second, it binds to the macrophages. Next point is that heparin is actually something that has a dose dependent clearance. Okay, so what is a dose dependent clearance? Dose dependent clearance, it's very simple. Okay, you give a high dose of a drug, there is more clearance, there is more half-life. When there is low dose of the drug, there is low clearance. Okay, so when you give 25 to 100 units of heparin, its usual half-life is 25 to 30 minutes. So the heparin's usual half-life is 25 to 30 minutes. So what is the half-life of heparin? 25 to 30 minutes. So duration to which it acts up to 4 to 6 hours. So it is given by subcutaneous and IV route. It acts for 25 to 30 minutes, half-life. 4 to 6 hours, there is duration of action. There is poor bioavailability because it binds to endothelium and to the macrophages. Then there is a very interesting part where it doesn't only bind to antithrombin thing. Okay, there are a lot of things that it binds to. It binds to thrombin. It binds to other proteins, other plasma proteins. And so, whenever there is increase in plasma proteins, when there is an increase in plasma proteins, when will there be an increase in plasma proteins? Whenever there is an inflammation, okay? So, whenever there is an inflammation and increase in plasma proteins, this heparin, this actually binds to all these plasma proteins and its bioavailability becomes low, its action becomes low. So in cases of inflammation, you have to like think about hiking up the dose of heparin. Okay, not essentially every time, but there is this mechanism that is happening. Okay, then finally the final point in pharmacokinetics I want to mention to you is about platelet factor 4. Okay, so whenever there is a clot, okay, whenever there is a clot forming, what happens when there is what are the steps in the formation of a clot? First there is vasoconstriction, okay. Then there is platelet aggregation, okay. Platelet gets aggregated, okay. Then there is platelet activation, okay. Platelet factor 4 is actually released from the platelets, okay. It is present in the present inside the platelets and it's actually released from the platelet factor 4 platelet, okay. So what this platelet factor does is this goes and binds with the heparin, okay. So platelet factor 4 released from the platelets, alright? So it's released from the platelets and it goes and binds with heparin, okay? So once it gets bound with heparin, it inactivates heparin, okay? So whenever there's an active thrombi forming, okay, whenever there's an active thrombi forming, there is no much role for heparin, okay, because this platelet factor that gets released from the platelet activating thrombi. This platelet is getting formed, and this platelet for factor 4 is released, and this actually causes inhibition of heparin, alright. So this is an important mechanism of action for an important side effect of heparin, okay, which we are going to see a little later, alright. So you have to remember all this, okay. So there's a poor bioavailability, 25 to 30 minutes half-life, 4 to 6 hours the duration of action, and there is why there is a poor availability, subcutaneous and IV infusions, and it binds to plasma proteins. It has this platelet factor 4 to which it binds, and whenever there is an increase in plasma protein, there is a decrease in action of heparin, okay. So we have just covered the mechanism of action and the pharmacokinetics of heparin, okay. So then what are the therapeutic uses of heparin? This is very important. So we have covered about the pharmacokinetics and the mechanism of action of heparin, alright. Now to the indications of heparin. So the indications of heparin, it can be used when there is a heart condition, whenever there is a brain condition, whenever there is a problem with the kidneys, and when there is a problem with the lungs, and there is some problem with the leg where it can be used, okay. There's lots and lots of uses, okay. So basically what are the cardiac indications of heparin, okay. First thing you have to remember is MI, alright. So MI, in non-ST elevation MI, ST elevation MI, you can always use heparin, alright. So 2 is, what is that? 2 is AF, alright. Whenever the heart beats irregularly, there is atrial fibrillation, we use this, okay. So why is it used? Whenever the heart beats irregularly, there is formation of thrombi, okay. So whenever this thrombi, this can actually get splattered and it can go into the circulation and it can go to various organs, okay. At this time, you use heparin, alright. 3. Where else do you use heparin? Okay, you use in severe cardiac failure, okay, alright. So in cases of severe cardiac failure, you use heparin, okay. So severe cardiac failure, there is stasis, okay. So stasis is essentially a part of the Witcher's triad, okay. So you use heparin. So these are the main cardiac indications of heparin. I might have missed few, but these are the main cardiac indications of heparin. So in brain, where do we use heparin? CVA. So CVA, do we use heparin? Okay. In CVA, usually the drugs are aspirin, clopidogrel and all that. Okay. So in CVA, when are the conditions where we use heparin? Okay. So when a CVA is an embolic CVA, okay. So there is an AF causing a CVA, then we have to use heparin. Alright. So AF, embolic. When there is an AF, okay, when there is a carotid artery thrombosis, alright, when the giant vessel, when the main vessel gets occluded, okay, and in cases of posterior circulation stroke, okay, whenever the posterior circulation is involved, okay, we use heparin, okay. So these are the conditions where in CVA you give heparin, alright. So in lungs, when do you use heparin? Pretty straightforward. PT, okay, pulmonary thromboembolism, okay. Pulmonary thromboembolism is one of the main indications that you use heparin, okay. So you give a 80 units bolus dose followed by 80 units per kg bolus dose, 16 units per kg per hour infusion, alright. So this is around 5,000 units, okay, of heparin. And in this also we use 500 units 2 to 3 times daily, but usually we give a QID dose with monitoring. Okay, I'll just come to the monitoring part a little later. Alright, so then you go to leg. Okay, leg, there is DVT. Okay, so DVT we can use heparin for prophylaxis of DVT as well as for treatment of DVT. Alright, so for both this can be used. So for assessing a leg, so you see a leg, you see a leg of leg which is patient is in prolonged rest or the patient is post surgery. So you have to assess the leg to start heparin or not. What do? You do Will's score. Okay. So in AF you have valvular and non-valvular AF. Okay. In case of non-valvular AF, there is one score which you have to calculate before starting heparin. That is Chalvas score. Okay. So I just thought I'll put the scores as separate videos. I'll just go in detail about this Chalvas score and Well score during that period. Okay. So in kidney where do we use heparin? So there are not actually some main things that come to mind with kidney for the use of heparin. Okay, but actually the highest doses of heparin per day is usually actually used with kidney. So when is heparin used in kidney? So with dialysis, okay. So in cases of dialysis in kidney, the blood needs to be in an anticoagulant state. So what does the blood do? The blood is actually taken out from the body, it goes to a dialyzer membrane and it cleans itself up, it comes up and then it comes into the body again. Alright. So when it goes from here to there, it should not coagulate in the circuit. Okay. This is why you use heparin in very high doses. This can be used this can be given as a single dose. It can be given as an infusion. It varies among institutions, but in India we generally give an infusion, and we usually use high doses of heparin with dialysis. So you should never forget the use of heparin in dialysis. Okay. So these are the main indications of heparin, and and you have to remember that it's not always the first choice drug in MI or in a CVA or in a deep vein thrombosis, because you know why. In an active thrombus, the heparin doesn't have much of a role. Okay, we just told that the active thrombus, it releases platelet factor 4. Okay, so this platelet factor 4, it inerts the heparin. Okay, so it doesn't have that much on an active thrombin. Okay, that is the reason why we use heparin as a second line drug of management. It's an essential drug, but it's not essentially a first line drug in all these cases. Alright? Okay, so the first line drug will usually be a tissue plasminogen activator. 90% will be a tissue plasminogen activator or an interventional procedure. Alright? So now you know all the indications. You give a lot of heparin, but you need to monitor the heparin, because heparin has deadly side effects. Alright, so how will you monitor heparin? Okay, so to monitor heparin, we have this one important test which you need to definitely know. Okay, so what is the one important test you use for monitoring heparin? So one important test for monitoring heparin is activated partial thromboplastin time. Alright, so this is the test, the test of choice for heparin. Alright, so this is actually a test we use in conjunction with PT, prothrombin time, PDT, and it comes with helpful to see the intrinsic pathway as well as the common pathway of coagulation. And this is actually also known as covalent clotting time. What is that? Covalent clotting time. So basically, you need to know if the thrombin is inactivated and factor 10A is inactivated. Okay, So you need to know these two, right? Okay. So to know that, APTT becomes very important. Alright. So this is also known as coiled cocktail. Again, APTT is like a huge topic which I will cover it in a different class. But the basic thing is thrombin and tenane. These two gets inhibited by APTT. Alright. So what happens when thrombin and tenane gets inhibited? The APTT prolongs. Okay. So APTT shows the prolongation. There is an anticoagulant effect. So this was used and is still used to see if the heparin is actually working or not. Okay. But this test has few problems. This, some people say, is not very accurate for heparin. Okay. So now factor 10A assays are tried. Okay. So factor 10A assays are actually now the investigation of choice for heparin. Okay. Although the more commonly used test and the more reliable test is APTT. Alright. So you give heparin, you monitor the level of heparin with the APTT or factor 10A, and you tightly regulate the level of heparin to avoid any side effects of heparin. Okay. So we have seen about the mechanism of action and the pharmacokinetics and the indications, and we have seen about the monitoring of factor of heparin. So finally we have to go for the side effects of heparin. Okay. So side effects of heparin is actually very huge, and I tried to cover it in a different video. Okay, alright.